systems, brought to you by Africa Health Business. My name is Kaushal Shah and I'm the head of pharmaceuticals and medtech at the firm. Before we start the discussion on manufacturing and supply chains, I would like to take you through some housekeeping rules. Attendees will be on mute during the session, and this webinar will be in English. If you would like to listen to the webinar in French, please click on the translation button on the screen. This is a 90-minute event. Please note that you can post your questions in the Q&A section on your screen, and your questions will be responded to as much as possible. Throughout the webinar, there will be pop-up questions, and we encourage you to respond. The results of the questions will be shared with you towards the end of the webinar. I would also like this opportunity to introduce you to Africa Health Business. We are a Pan-African boutique consultancy and advisory firm based in Nairobi that aims to improve access to equitable health in Africa. Through a private sector lens, we provide organizations with actionable insights to grow their health agenda in Africa. On this slide, you see the agenda for today. I would like to reiterate that this is a 90-minute session. But before we dive into today's discussion, here is a short clip on one of our event sponsors, the Medtronic Foundation.
Medtronic Labs is built upon 5 principles. First, we design with and for the communities to address local barriers across the care continuum. Second, we employ evidence-based practices and protocols for uncompromised clinical excellence. Third, we address the social determinants at the root of poor health. Fourth, we integrate digital and product technologies for high-tech, high-touch models of care. Fifth, we innovate operational models that enable efficiency at scale. Learn more at www.medtronic.com/medtroniclabs.
I'd now like to set the scene for the topic for today, which is manufacturing and supply chains. So COVID-19 has greatly disrupted our supply chains. The measures to contain the pandemic have triggered unprecedented measures by national governments that have caused local and global trade disruptions. This has threatened our supply chains not only for the management of COVID-19, but also for essential commodities. With imports comprising as much as 70 to 90% of all healthcare products consumed in most countries in Africa, it is important that we consider an increase in the local production of these products. Taking pharmaceutical as an example, on the continent's reliance import, most countries are uncompetitive for local pharmaceutical production, and only a small number of African countries have a handful of local companies who produce for the domestic market. The continent overall has approximately 280 drug manufacturers, which are clustered in 13 countries. As highlighted in the map, Morocco has developed a sizable pharma industry, as well as South Africa, Kenya, and Nigeria. Almost all companies are drug product manufacturers. Up to 100 manufacturers in sub-Saharan Africa are actually limited only to packaging, purchasing pills and other finished drugs in bulk and repackaging them into consumer-facing packs. And only a handful of drug companies produce APIs, and none have significant R&D activity. Africa's pharmaceutical demand is met mainly from Asia, which over a third of the drugs in terms of value coming from India and China, then Europe, with countries like UK, France, Germany, Switzerland, Italy, and Ireland meeting our needs, followed by the US. There has been some advancement in local manufacturing, with companies in the private sector, such as Revital Healthcare in Mombasa, producing medical commodities such as syringes, and Biovac in Cape Town producing vaccines for diseases. But by far, the majority of the investment has gone towards pharmaceutical manufacture, as I highlighted before. And practically no investment has gone towards the local production of more sophisticated devices and equipment such as MRI and CT scans. The pandemic has highlighted that we need a more coordinated, reliable, and self-sufficient healthcare manufacturing and supply chain in Africa. We need to work on policies and regulations that will strengthen local manufacturing capabilities, and we really need to work on continental harmonization of policies and expand intra-Africa trade. Additionally, we really believe that PPPs are essential for the genuine progress of our healthcare product manufacturing capabilities. Africa Health Business is at the center of this partnership drive, which is why we're having this discussion today. I'd like to highlight one such partnership, which is the Africa Medical Supplies Platform. The AMSP was developed to ease the difficulties and open up the medical supplies market to Africa, and as a part of the partnership to accelerate COVID-19 testing of Africa CDC. It integrates African and globally vetted medical supplies to ensure cost effectiveness and transparency in the procurement and distribution of COVID-19 related supplies. I'm sure that we will hear more about this during the discussion. Now, I would like to hand over to the moderator of the session today, Dr. Amit Thakur. Thank you.
Thank you, Kaushal, for that setting the stage. It's pretty clear that we have to do something a little bit more innovative around manufacturing and supply chain in Africa. And indeed, the pandemic unraveled this situation where the global supply chain interruption needed us to be innovative on looking inwards rather than looking outwards for supplies to ensure our health system remains intact. In fact, the frantic move by ministries of health just to look for PPEs and maybe goggles and sometimes boots to save health worker lives and lives of other citizens showed why we need to be a little bit more inclusive and dependent and self-reliant. Repurposing many of the garment factories to start producing overalls was seen to be an important move and may have saved thousands of lives of our health workers. But Africa showed it can do that. But that's for maybe PPE. How about vaccines and how about medications? That's indeed a very technical and a long-term plan. So we know we need to plant the seeds now. We need to be innovative now so that when we have the next pandemic and the one after, we become self-reliant and can save lives of children, mothers, and citizens across the continent. We have seen many of the people on this panel today in the forefront of making Africa self-reliant. I'm so delighted that we have an illustrious panel here, ranging from the champions who are running policy, those who are innovation in digital health, those who are leading manufacturers on the continent, and those who are truly global in their approach and have worked in Africa for a long time. It's my pleasure to actually share this stage with them and learn a lot about where we are going in the manufacturing supply chain, not only because of the pandemic, but what it has led us to start thinking about becoming more inclusive. We will have this session through a panel engagement. Your questions will be taken in at the end of this panel conversation. So feel free to write in your questions or suggestions, even comments. And we will have some parting shots from the panelists that will all lead into a report that we'll share with all of you who've logged in. I'm so delighted. We've been getting close to about 35 to 40 countries that log in. We get lots of the delegates from Africa, but we've seen US, UK, and Asia also equally represented. So it's truly a pleasure to now invite our keynote speaker who will set the stage, Chidinma Ifipe, who is the head buyer of the Africa Medical Supplies Platform. Kaushal showed you the screenshot of the homepage, and those of you who haven't been to that platform, please do so. I think it's one such platform where telecom companies, non-healthcare companies came together with leaders in institutional continental movement like Africa CDC to show what Africa can do for Africa supply, and we can be reliant. We are proud of this platform. It's working. I hope it continues to remain a place to go for ministries and private sector to effectively buy quality at the reasonable price, which has great transparency. So without much ado, let me invite our keynote speaker, Ms. Chidinma Ifipe, to tell us a little bit about the platform and on what they've done in supply chain. Chidinma, welcome. Over to you.
Thank you very much, Dr. Amit, for that great introduction. And I'm very honored to be speaking to all of you and sharing a little bit more about the Africa Medical Supplies Platform. So, just to get started, I'd like to take us back to the start of the pandemic. At the time, we had not seen rapid rise in cases on the continent, but through associations and the work the African CDC was doing with the WHO consortium, Africa had secured some diagnostic test kits for testing on the continent. But if you look at the allocation that was given to Africa, it was something around 10 million diagnostic test kits, and it was supposed to be for 16 weeks for the continent. These pretty much came to about 46,000 test kits by country by month. Just hearing those numbers, you can already tell that if we were restricted to this amount of supplies, it was going to be really difficult for us to scale our testing strategy. And as you already meant, as Ms. Shah already mentioned, one of the African CDC strategy to really manage the pandemic was to implement the partnership to accelerate COVID-19 testing. This was really critical in scaling the COVID-19 testing on the continent. So enter the African Medical Supplies Platform. This is the brainchild of multi-stakeholders, everybody from the African Union, African CDC, to the Economic Commissions of Africa, to the African Export-Import Bank, and us, the private sector players on the platform. That's Econet Group and Django. What we really wanted to do here was just to come together and build a supply mechanism that was leveraging the very best of the private sector e-commerce infrastructure and the very best of knowledge and health, uh, public health expertise to build up a chain that will, provide real-time access to a global manufacturer base for the continent. But in thinking through the structure, we started seeing some possible bottlenecks. For example, Africa is not only dealing with the COVID pandemic, we've always been dealing with multiple cases of infectious diseases and some other, multiple health scenarios. So you start thinking through how do you want to make sure this is valuable for African Union member states? How do you want to make sure that this is accessible to donor organizations that want to support member states in their COVID-19 strategy? So sitting with this group of stakeholders, the blueprint for the African Medical Supplies Platform was really born, right? We wanted to create a digital marketplace that will support both the sellers and the buyers on the continent to access these critical medical supplies. And because we were also conscious of transparency of costing, we were also conscious of making sure there was real-time availability of these supplies. We were also conscious of making sure the supplies were with the right quality and from certified suppliers. We had to work with multiple players to design, at the very least, an MVP as a response, as an emergency response to the pandemic. But since we launched in June, what we've seen has been a real-time shift of demand. So it started off with a huge demand for PPEs. We have seen it gradually shifting to diagnostics and critical equipment requirements. So that said, you can see that just having an extra source of supplies really provided a lot of confidence in healthcare systems. They were confident enough that they could fight the pandemic because of the support at the level of the African CDC or at the level of, whether it's the Afri-Exim Bank or whether it's the UNECA team. Another thing I'd like to really draw your attention to is the fact that while we have established this structure and are running it in an emergency scenario, there are a few things that we've also seen that, you know, that is not unique to our situation. So what we've seen, right, is how vulnerable the supply chain system is. We've seen how much needed an agency like the African Medicines Agency is when it comes to harmonization of regulations across the continent. Because once you get orders or products from certain manufacturers, once they come into the continent, you realize that there are 55 different regulatory bodies that need to approve and certify those products before they can be utilized in their different countries. This slows down how fast products can get to end users or remote communities. And this also kind of slows down it kind of also slows down some of the gains we might have seen in acting really fast. So I guess what I really am trying to say is that the platform it's a novelty that we hope will be carried on far into the future as we discuss as conversations around the African Trade Continental Agreement progress, as negotiations around that progress. We hope that this is a start of integration between technology and, you know, public sectors, policy makers. The opportunity to leverage existing infrastructures that have worked well in private sector, in the public sector, cannot be overemphasized. But just to really wrap up here real quick, what I'd also just leave you with is the African Medical Supplies Platform is just one instrument targeting, you know, manufacturing and supply chain conversations on the continent. But the reality is there are multiple other business units or organizations doing incredible work in this space. And we must continue having these discussions. We must continue, you know, shining the torchlight or shining light on some of these conversations that need to happen to really ensure we can leapfrog into the future. Today, Africa is about 1.3 billion, you know, population size, but tomorrow there's an estimate that it's going to be around 2.4 billion. And the structures we have today, I don't think they're enough to scale for our population size of tomorrow. So these conversations are very important, but they are also as important as the players or the private sector communities or the organizations that speak up for these solutions. We must come together to build a strong and a structured, sustainable framework for growth. Thank you very much.
Thank you, Chidinma. Let me, on behalf of organizations, delegates, and people of Africa, congratulate you, partners like Econet, Django, Jumia, and many others who made this happen. So we wish you all the best. And you said it correctly that it should actually outlive this pandemic and becomes a singular platform for suppliers and buyers to make sure they have the right match. And talking about the right match, we have, of course, the Continental strategy being led by an institution that we are again very proud of, and that's Africa CDC. Dr. Ahmed Ogwell, who I have known for a few years, is now leading into the leadership team at Africa CDC, who can also come and tell us when there was a flurry of tests not being available, we received donations from China, you guys were in the forefront. When we had to distribute to the entire continent, you were in the forefront. When you had to team up with Ethiopian Airlines, you are again in the forefront. And now when it comes to vaccines, and we don't want to be left behind, you're again in the forefront. So I'll leave it to you, Dr. Ogwell. Where are we in this arena, and what do you think is really sustainable for Africa? What's on top of your mind as when leading Africa CDC? Dr. Ahmed, over to you.
Thanks a lot, Amit, and good morning, good afternoon, good evening, colleagues, wherever you may be joining from. It's a pleasure to participate in this session today on behalf of Africa CDC. Maybe I start by saying that Africa CDC is just about 4 years old now. Launched in January of 2017, and is a child, if you want, of the experiences that we had with the Ebola outbreak in West Africa. It was very clear in the minds of our leaders, our heads of states, that we needed our own public health agency here in Africa to be able to coordinate our response. And in our 4 years, we have tried to meet that mandate. And I think under this COVID-19 pandemic, we have lifted a lot more than a 4-year-old should be able to lift. Now, today I want to focus a little on the topic, which is really this partnership for resilient health system, looking at the manufacturing and supply chain aspects of it. And maybe I step back a bit and I start by saying, when we have different types of outbreaks on the continent, it is usually just a few countries. Even the Ebola one was just about 3-4 countries that were involved actively. But with this pandemic, with the COVID-19 pandemic, it is literally everybody that is involved. Now, one very initial result of the pandemic is that everybody needed everything that was required for COVID-19. And so wherever anything was being manufactured, gloves, masks, test kits, PPEs in general, ventilators, oxygen concentrators, you name it, wherever, I mean, ICU beds, wherever anything like that was required was being manufactured, there was a ready market, and people from different parts of the world, different governments, different organizations wanted to purchase. Now, this put a very unprecedented strain on the supply chain globally. For some weeks, China was manufacturing absolutely nothing because of the lockdowns there. And China has become really one of the core factories of the world. And when they were manufacturing nothing, it meant that whatever was in stock was running out quickly, and yet the need was still growing because many more countries and many more individuals required these supplies. So when you look at the international perspective as far as the COVID-19 supplies are concerned, first was the shortage because the supply chain was disrupted. Manufacturing was not happening at a good rate, and the demand was increasing. So generally, the shortage was at all levels of the supply chain. And then secondly is even when you have the product somewhere, moving them from point A to point B was extremely difficult. So that part of the supply chain was also cut off because literally every country was on lockdown, and moving goods and supplies was extremely difficult. At Africa CDC, we had the almost luxury of being able to move in and out of countries in Africa because of the key support from our member states. We had access to military aircraft, and we could be able to arrange landing rights in literally any country on the continent. And this provided us with the ability to be able to move our staff relatively easily to go to the source, I mean, to the epicenters of the pandemic at that time. But in as far as supplies is concerned, because we were not manufacturing much on the continent when we first had our case in February 14th, we had to make special arrangement how these supplies would then be able to get from wherever it was, whether it is Asia or Europe or North America, how was it going to get to us here in Africa? And when it gets here in Africa, how will it reach the laboratories, the health workers, and other institutions that required those supplies? So movement was a very, very big challenge internationally. Third challenge internationally was the issue around quality, because the demand was so high. Individuals, some very crafty, different companies started to repurpose their facilities so that they could be able to manufacture some of these items that were really, really in high demand, like masks and the overall gowns that we need for our frontline health workers. And so the issue of quality came about. How are you sure that what you're buying is actually going to protect you? It may look like a mask, but does it have the protective abilities? Many of our standards bodies, regulatory bodies, were not functioning at full scale. And so these supplies had that question mark. And as Africa CDC, what we did was to deal only with the suppliers we knew had good products and whose certifications were above board. And it was not very easy because there were not too many that were working at full speed at that time. Now, when we look at challenges on the continent during that time, one, as Africa CDC, was just basic quantification. How much do we need of each and every item? Because we did not have adequate numbers in as far as what was the burden of disease at country level. Although the numbers were small, but then the populations were large, and the people who are going to be at risk were also large. But then how do you quantify what you need so that you can be able to purchase in amounts and at speeds that actually do help those who are in the front line of this work? Second was when you have purchased the items, then how do you move them? And as I said, we were in very good, and we still are in very good partnership with Ethiopian Airlines, whose cargo flights did not stop. And now we are expanding that into other airlines on the continent to be able to move our goods relatively easily. Second challenge as Africa CDC we had was actual procurement, because everybody wanted it, these items. So how do you make sure that you're getting good quality? How do you make sure that you're getting it in good time? How do you make sure that you have the resources that you need? And here, our partners from across the world came through very well and provided us with the resources that we needed to be able to move some of these supplies very fast from wherever it was being manufactured to Africa. And also our friends across the world made some very critical donations at a very critical time that helped to ensure that Africa was functioning at very decent levels. But a very big challenge that to date African countries still have is market intelligence. Where do you get a particular product? Where do you get a particular good product? And how are you able to access it at a price that is reasonable? So these skills sets that Africa still needs to develop, and we are working with the African countries to be able to bring those up as fast as possible. I've spoken about logistics. Too few humanitarian corridors were there then, and as the second wave comes into Africa, and we expect some partial lockdowns at least, this is something that we may face again, but I think we've built enough experience over the last 8 or so months, and we think we can be able to handle it. Now, as Africa CDC, we then responded, and we need some key things, some of which have already been shared. One was the chairperson of the African Union Commission, His Excellency Musa Faki Muhammad, called all the health ministers here to Addis Ababa, February 22nd, to sit and discuss how best we can be able to respond to the pandemic, because the first case had already been reported in Egypt a week earlier. So the ministers then adopted the Africa Joint Continental Strategy for COVID-19. And that strategy is what has been guiding our response activities. It has been guiding the preparedness that we are supporting countries to do. It has been guiding our planning, not just for this particular pandemic, but for any that may be able to come. We are building good capacity in that area. Secondly, under this strategy, we established the Africa Task Force for Coronavirus. And this task force is headed by, at national level, by the directors of national public health institutes or similar agencies in the different countries or similar departments within ministries of health. We meet every week, every Tuesday, and we assess where we are, and then we chart a way forward based on the evolution of the pandemic. Third is we launched the partnership to accelerate COVID-19 testing on the continent. We call it PACT. it was very clear to us from the very beginning that if you don't test, you cannot be able to know your burden. If you don't know your burden, then you cannot be able to prepare well. So we established this partnership, and we brought on board very many different aspects of response, that is testing, tracing, and then treating. And we had a very good set of partners who are supporting us in being able to realize this particular partnership. And in fact, our member states within Africa, when we established the fund, the Africa Union COVID-19 Response Fund, they very generously donated into that and gave us the required resources that we could be able to use to ensure that we are getting our supplies right, to be able to support our responders and our member states out in the communities. Then you've heard about the African Medical Supplies Platform. I'll not repeat that, but I will talk about vaccines. We held a conference, and at that conference, a strategic plan was adopted, and out of that, we have established a consortium for COVID-19 clinical vaccine trials on the continent. And here we are looking at how does Africa participate in clinical trials? How does Africa ensure equitable access to whichever successful vaccines will have been proven to work across the globe? And how do we ensure that we can actually get vaccination to be done? Because having the vaccine is one thing, but having vaccination being done is another one. And we have huge challenges on the continent around the anti-vaccine brigade is there, telling everyone how bad vaccination may be. We have cold chain issues. How do you make sure that it actually reaches the populations out in the villages and the countryside? And we also have issues of personnel. Do you have enough well-trained health workers to be able to be out there providing this vaccination? So as Africa CDC, we have established a process following the direction of the Bureau of the Assembly of Heads of States of the Africa Union, led by His Excellency President of South Africa, Cyril Ramaphosa. And we've been given very clear marching orders that we go out there and we do things as boldly as we can to ensure that Africa is fully participating in preparing for the vaccine season, which is going to come, looking at the number of vaccine candidates that look like they may become successful. Then recently we launched the Africa Against COVID-19 campaign, which is for saving lives, saving economies and livelihoods. We are targeting opening up the economy safely, opening up schools safely, and ensuring that we can be able to also travel safely. There's a lot of detail on that, but I'll not go into it. Now, let me talk finally about the opportunity to manufacturers on the continent. If you look at our continent, we have the potential. The health market is over 250 billion. That's the potential that we have. But local manufacturing is still extremely small. For drugs alone, we probably import something in the range of 90 to 95% of what we need. For equipment, it is even higher than that. We are probably in the 98% range, meaning that the opportunity for African manufacturers to be able to step into this space is huge, and we need to be encouraging them to not only begin thinking, but also start creating partnerships for appropriate technology transfer so that we can start manufacturing here on the continent. In fact, if we did that even in a small scale, the number of jobs that can be created will be in the tens of millions. And this will protect our supply chain so that tomorrow when we need to react quickly, where we have our factories here, we have our knowledge here, and we have our products being manufactured here on the continent. And this is a very big opportunity that we hope our African manufacturers will be able to take it up. And this is being supported in a very big way by the African the Continental Free Trade Area, which is a very key tool and platform for our African manufacturers to be able to access markets, and now that there'll be free movement of goods and people eventually. So it is really an opportunity for our African manufacturers to start accessing local markets. Of course, we are also working with technology to try and ensure that pool procurement is benefiting the African country and the African citizen. We are trying to scale up the capacity for sustainable financing by ensuring that governments understand the need for putting in their own money, so that our local philanthropies also appreciate the need to invest back into the societies in Africa, and our private sector also do what is required to build the African capacity for domestic financing. So in conclusion, Ahmed, I will say that the three big things that we really need to put in place. One are systems. We need to put in place systems where we can be able to collect data quickly, analyze it, and use it for purposes of securing our own supply chain. Whether we are manufacturing here or accessing it from outside, we need that data, and that data need to be accessible at the click of a button. And it is possible to do. We have seen it happen during the COVID-19 times. We update our data twice a day, meaning that we have real-time data that we can be able to use. So systems need to be in place, and these systems must be backed by policy, by law, must be backed by planning and resources from government. The second thing that we need to put in place is local production. We must start producing our own PPEs. We must start producing our own therapies. We must start producing our own vaccines. Africa is producing a lot of vaccines for animals, and the base of any vaccine is the same. It's a pathogen and it's a living thing. And if we can be able to produce so much vaccine for animals, why aren't we producing vaccines for human beings? So we are challenging the African manufacturers and those who would like to be able to invest in this. Let us get our local production running in all areas that we need. And finally is we need coordination. And this is where Africa CDC comes in. We must coordinate irrespective of where we work from, private, public, intergovernmental organizations, philanthropies, private sector. We must coordinate so that all our energies are in synergy, and that produces something that is positive for the continent. This is what I would like to say for today, and I thank you for the opportunity.
Thank you so much, Dr. Ahmed Ogwell. That was spot on, your clarion call with the 3-point message. And we at Africa Health Business are so delighted to partner with you, bringing the private sector for coordination. We will also talk about local production, that you have challenged the African manufacturers, and about systems. And talking about South Africa, and I know you mentioned Cyril Ramaphosa, who's also quite a champion in the Continental strategy. I want to invite now a local manufacturer on the continent who is literally making a big impact in many ways in R&D, and they could scale up more. And I think, you know, it's not that easy for local manufacturers, and they also have an ask and a wish list. And I think if we got all the asks and the wish list from the local manufacturers, Africa CDC could actually overlay this, and we could scale up with the Africa Continental Free Trade Agreement. So why are the numbers low? What can we do? I mean, we've been talking about this for long. Is it API? Is it costs? Is it advanced market commitment from the government? Is it payment? All these are bundled in, but you make a clear point that we could and we must do more, whether it's PPEs, therapies, or vaccines. Let me invite a champion on the scene in local manufacturing, Dr. Stavros Nicolaou, who is from Aspen, and he will talk to us from South Africa. Stavros, over to you.
Program Director Amit Thakur. Should I add the immensely talented Amit Thakur? Amit Thakur. Fellow esteemed panelists, colleagues, and ladies and gentlemen who are on this webinar, it's indeed a great pleasure on behalf of Aspen Pharmacare for us to participate in this panel discussion. Might I add a very important one in many different respects. And I'd like to touch on why it is a critical conversation that we're having today. It's in fact not a conversation that's only shaped or constructed by the unfolding pandemic that faces us, but it goes a lot deeper and much more broadly than just the COVID pandemic that we're facing. Amit, I'd like to respond to your various questions by predicating my responses on a few observations and also some personal life experiences. So if you'll allow me, let me make some of those observations up front. And some of them might be apparent and others less so, and might even be revealing, and in some instances an indictment on what we do actually. We know that Africa has the most disproportionate disease burden of any continent in the world. We also know that Africa is characterized both at a pharma and also at a medical equipment and devices level, is characterized by what I think is best described as a galloping pharmaceutical and medical trade deficit. Even for South Africa, which has probably the most developed pharmaceutical manufacturing base on the continent, you might find it both interesting and also curious that South Africa's pharma trade deficit is around 65% of the size of the market. So to be a little more precise, the pharma market is valued at 58 billion ZAR, South African rands, and the trade deficit sits at between 35 and 37 billion. That's not a very good picture, and the rest of the continent mirrors that. In fact, it's worse in the rest of the continent. It's also the deficit, that is, sectorial deficit, is also the 5th biggest contributor to South Africa's current account deficit. Now, these are all important metrics that rating agencies, sovereign rating agencies, and other investors, whether it be investment bankers and the likes thereof, or investors that are financial investors, whatever the case might be, these are not good metrics. And in fact, don't make sense, because if you have one of the most disproportionate disease burdens and one of the highest consumption of medication and one of the lowest per capita GDP spend, common knowledge would say to you that you should be producing more of these products on the continent. And that's why I say it's quite an indictment on all of us, because we should never be placing ourselves and future generations in that position. I'm really grateful being part of the Aspen management team, because we've significantly bucked that trend. And we've done this in a fairly short space of time. Aspen, I was telling some of the colleagues earlier on this call, has been in existence for 23 years. So we moved rapidly out of infancy into teenagehood. Sort of, we were quite active as toddlers as well. And we're now emerging into early adult lifehood. And I think we're very well positioned as adults to make a significant global, not only a continental or in-country contribution, but a global one. We have quite a simple business model, which I don't have time to unpack on this call, unless you want a follow-up question later, Amit, happy to delve into that. But Suffice to say that we've approached the pandemics that have manifested on the continent over the last 2.5 decades. We've approached them very much with a patient-centric mindset. And this led to us pioneering antiretrovirals, generic antiretrovirals on the continent. We were able to reduce pricing from $5,000 per patient treatment per year, triple first-line cocktail therapy, from $5,000 per patient to around $165 to $170 at the time. We responded rapidly and swiftly to the multi-drug resistant and later the extreme drug resistant TB by producing two important drugs on the continent. These two drugs, cycloserine and capromycin. Capromycin incidentally involves lyophilization. We were able to introduce that technology onto the continent. And fast forward to where we are today, we announced a week ago quite a groundbreaking deal with Johnson & Johnson. It's a technology transfer and proposed commercial manufacturing arrangement for J&J's, I think, much publicized candidate vaccine. It's a significant development because to have a South African company manufacturing a vaccine for a company as credible and well-reputed as Johnson & Johnson for global markets is a significant achievement for Africa. It's a vote of confidence in both our scientific capabilities and our technical capacities on the continent. So I'm only really trying to demonstrate this by saying to you, it is very possible to achieve this in the continent, and I think Aspen has proven that it's possible to do all these things. So let me end off by saying that you've raised certain challenges, Amit, for us, and those challenges are, what is it that we as Africans need to do to both galvanize and stimulate local manufacturing on the continent, so we're not perpetuating this unacceptable existence of continuously being import dependent and reliant, and basically placing our hopes and future on imported product and other continents and countries to save us. There's a couple of things we need to do. There are three things, in my opinion. Well, there are a lot more than three, but there are three key and manifest issues we need to be tackling. The first is we need to have absolute commitment and conviction and courage of our convictions. There's not a week or a month that goes by on the African continent and we're not discussing an African pharmaceutical manufacturing plan.
Sure.
And we talk a lot about it, and without being, I'm not in any way being facetious here, but we put up great presentations, but we never seem to be able to get to the implementation phase of any of these things. And this is largely because we are focused on the short term, not the longer term. What I mean by that is we might look to start procuring locally, but then the next importer flies into the continent and the best laid plans for local manufacturing go up in the air in a pile of smoke, literally. Right. Sometimes it's fog because you can't even see through what's happening, because this is the short-term approach that we're having on the continent. So number one for me is we need to say we are going to be manufacturing whatever country it is on the continent. Mm-hmm. And come hell or high water, no matter what pain we're going to take, we are going to stay committed to the course that we've got to follow to get there. We're not going to be derailed by the next importer that flies in and dangles a carrot. We are going to stay true to the course. So that's the first thing we have to do. The second thing is The industrial levers and policies we have at our disposal in the continent are not well coordinated. They're not well coordinated from the perspective that many countries around the world, when they're looking to kickstart industries, to attract investors, they call those investors in and they give them a guaranteed offtake over a longer term. This, our continent is left to the devices of 2-year tenders, sometimes a 1-year tender, and a significant amount of buying from donor funders. Now, donor funders might be well-intentioned, but they're not great for creating industries. And they're largely part of the problem that perpetuates the deindustrialization or the lack of industrialization on the continent. So we've got to get small entrepreneurs, and there's some of them on this call, and say to them, look, you want to invest $10 million or $5 million, whatever the number is. Okay. We're not going to leave you in the lurch. We're not going to let you produce for a year. You win a tender and then you lose it and you're out of business and you're retrenching 200 workers. We will give you a long-term offtake, 7 or 10 years. We will price benchmark, so there's no rent seeking here. And we will allow you or give you that certainty and predictability that any investor in any sector would be expecting. It's no different in pharmaceuticals. It's very disturbing almost that the same principle that might be applied in mining or any other sector is not applied in this sector. And it's because of that short-termism that I spoke about earlier. My final point that I wanted to make is around regional and continental integration. I think we all know that manufacturing is largely about getting economies of scale, and those economies of scale give you competitiveness, both domestic and global competitiveness. You can never hope to be competitive if you depend particularly on the African continent where the volumes are so small. You cannot say, well, I'm going to set up a manufacturer in a particular country. The volumes are small and your importer competitors take you out of business in literally months. You cannot have that situation. We've got to look to better apply the regional and continental consolidation, whether it's through the free trade agreement or other levers we might have at our disposal to get economies of scale so that the few producers we have and hopefully new ones that come into market will have access, true market access to economies of scale that start making manufacturing sense. So Amit, again, thanks very much. I'll pause there, and it's been great speaking to you all.
Thank you, Stavros. I think you really hit the nail on the head when we talk about the 3 points you made. One is to remain focused. The other one was long-term contract, short-term don't work. And you talk about volumes and economies of scale. So, literally on how Chindimane and Dr. Ogwell started, you've actually brought the true picture on the ground as a manufacturer. If you ask any manufacturer on the continent, when they say, who is the father of them all, you'll be among one of those at Aspen. And we wish you all the best. I also want to congratulate you for this engagement with Johnson & Johnson. And as we look at the expansion of local manufacturing, I'm sure we'll see Aspen being dotted in many parts of Africa. Let me now quickly move to...
Hopefully I'm a young father though.
Yeah, you say 23 years old father. So there are those who are like 4 and 5 years on the panel. And so you are definitely an organization we respect. Talking about global space and volumes, Dr. Harold Nusser knows what it means to run and manage large institutions like Novartis with social enterprise on the continent. He has had an illustrious career there. Harold, you can see what Africa is talking. You're dialing in from outside Africa, but you know Africa. You understand. There is this intense desire to be self-sufficient. Be open to us about this. Tell us honestly what your advice is. Are we going to make it so that we can have a resilient health system towards supply chain. Welcome, Harold.
Thank you, Amit. It's a pleasure to be with such an illustrious panel. It's not only about advice to Africa. I mean, who am I to give advice to countries in Africa? It's also in order to reflect on the role of the private sector and potentially digest advice the private sector would need to get in order to be an even better partner in the future. So let me share briefly, as I'm transitioning from Novartis, views and experiences I'm sharing are my own and my personal opinion. And in the interest of time, I leave out a review of what's driving the private sector to engage in public-private partnerships, but rather zoom into concrete observations and subsequent questions to ask in the implementation. Coordination will be key for all this, and I'm glad, Ahmed, that you have mentioned this on behalf of the African CDC already. I really think coordination also between private and public engagements are going to be very key. And to say it with the words of Alan Jobe, the CEO of Unilever, measure what you treasure. You don't get what you expect, but what you inspect. So here are some observations from several engagements with, by the way, different private organizations I have been associated with in the past. It is important for both sides and co-creators to really have a situational analysis done before a public-private partnership is even manifested in a memorandum of understanding. And in a way, I've and with my team learned this also in a hard way. When we looked at non-communicable diseases, we figured out that in one country, the prevalence difference from one subnational level to the other was as much as more than 15 percentage points. So if you were looking at hypertension, for example, this could be largely different and completely unexpected when comparing with the overall national assumptions disseminated, for example, through global databases or through the WHO. NCD medicines are usually not found in facilities, but they are available more than 80% in pre-diagnosed households. So there is a mechanism which allows patients and households to get hold of the medicines. Question is, how is that really working? And to understand that and to work on this is going to be critically important with all engagements with regard also to vaccination in the future. I've also learned that the global WHO essential medicines list usually does not coincide with the national essential medicines lists. They are not frequently updated, though I see an improvement in the previous years. Yet there are referral hospitals as well, and they operate with yet another procurement list for their facilities. And even the national essential medicines list does oftentimes not coincide with the medicines which are foreseen from the standard treatment guidelines. On top of that, the National Hospital Insurance Fund would not necessarily need to cover NCD medicines. So that leads to an observation which I've also made. The poorest wealth quintile, the poorest people, pay the most in absolute terms even. And this is for various reasons, but they not only pay the highest amount, the highest price for their medicine, but they also need to pay 3 times. First, they pay for the health insurance and might be disappointed. Second, they may procure insufficient quality, so the medicines are not working. And then they have to pay for the real medicine. Now, what that tells me and what the observations clearly are is there needs to be coordination in order to have that situational analysis really done and conducted without time pressure and without undue delay before a public-private partnership starts, on one hand. On the other hand, we increasingly see that that organizations, institutions, but also the private sector is reporting on the number of people that they claim to have reached or that they claim to reach. Usually this number is derived algorithmically by the boxes that have left the facilities or the manufacturing sites. But does that really tell a lot, or is that just a business indicator? From my perspective, it's critically important to minimally look at the number of patients reached at the facility level, and then ask further questions. How have those patients been reached? Through a functioning health system? Have the prescriptions been made according to the standard treatment guideline, or have those prescriptions been made based on what the prescriber knew was available at the nearest pharmacy or at the public facility and what they had on stock? Has the coverage of the population through a medicine supply partnership really increased? Or was it just about substitution? And if it was partially maybe on substitution, has the out-of-pocket spend really been cut down? So that consumption data at household level is really been blended with income data, and that all those questions and looking into those would give answers on the societal impact eventually a public-private partnership would have had, not just counting the boxes. So how could solutions for that look like beyond the situational analysis? From my perspective, it's important that stakeholders, especially and in particular also the private sector, moves from a we know to a we learn mindset, from a we own to a we share mindset, from a we lead to we help convene mindset. And then applying something which I've recently read about, what I call briefly the WHO checklist, which puts out requirements for public-private partnerships and transparency on those. For example, information should be disseminated that if extra resources would need to be deployed, have they been potentially diverted from other company priorities? And then critically and openly discuss this. Has there been a pre-established monitoring and evaluation framework and logic model? Is there a public disclosure plan for the results or interim results? Or another example of that WHO checklist is, have transition plans been worked out to local ownership once that public-private partnership ceases to exist? All that needs coordination and trust amongst partners, but sharing vulnerability, admitting failures, and sharing why the organizations have a vested interest to engage in a public-private partnership would be a good first step to building that trust. Thank you.
Thank you, Harold. And I think you really stressed on the word coordination, literally taking on one of the three pillars that Dr. Ogwell talked about. Let me move on because of time. I do want to invite now Yasmin Chandani, who is in Supply Health, an organization that will take us through a few slides and points that Yasmin wants to make. Thereafter, we will go to a few Q&A. Quite a few questions and answers are coming through. We won't be able to go through all of them, but we will ask the panelists to try and respond in this space before we just give the final parting shots, and we'll share with you the poll results at the end. So stay connected. Yasmin, it's a delight to have you with us. I'm so glad that you can spend some time and share with us innovations in supply chain, on how we can make it more resilient, responsive, and equitable. Welcome, Yasmin, over to you.
Thank you so much, everyone. And Amit, and happy to be on the panel. I don't know if my slides are coming up. Can you see me? Okay, here they are. So my name is Yasmin Chandani. I'm the CEO of InSupply Health Limited. We can go to the next slide. I'm not going to spend too much time on each slide. A little bit about InSupply Health, and I think I'm going to take us all in the next few minutes and really tunnel in on the in-country supply chain and the view of the in-country supply chain to complement what you've heard from our other speakers. In Supply Health is a Kenyan supply chain advisory firm. We're affiliated with JSI, but we are a small social enterprise and startup. And we're really very focused on a couple of different things. We believe in localization, in contextualization, and our mission is to transform lives through co-creation. So along today's lines around partnership, very much co-creating innovative and sustainable solutions for healthy communities. So we can move to the next slide. One of the things that we strive for is that supply chains reach clients with the products they want and need. As we've all heard, that COVID, one of the things COVID did at what we've heard from our colleagues, at manufacturing, at global, at regional levels, there's been significant disruptions getting to the country level. But even at the country level, it's important that once it gets to the country level, it actually reaches clients at the end of the supply chain. And so if you look at what it takes to build these resilient, responsive, and equitable supply chains, what did we learn from COVID? Actually, COVID didn't teach us, it didn't have surprises for us at the country level. It revealed vulnerabilities we already knew in supply chains. We know that resilience is vital, that supply chains need diversified sourcing strategies. They needed to be able to update their inventory policies in the current context. And they need to reach everyone equally. And all of these things were reminded to us when COVID happened, that inequities in access were magnified. So as we experienced shortages, those who are marginalized in the health system were even more marginalized. We also know that responsiveness is heavily dependent on data. And yet, as we've heard from colleagues before us, Dr. Harold himself mentioned, without data, it's impossible to be responsive because there are such differences in regions within our different counties of the disease burden. Without that data, it's very hard for supply chains to deliver commodities where they need. And yet we know that sometimes our national information systems are fragile, and with COVID and disruptions in work attendance, the data became even more unreliable. So two things that I'll talk about that are really important for resilience and responsiveness. Taking a client-centered approach. It's really critical for ensuring that service and supply chain continuity. We heard from Stavros how Aspen is taking a patient-centered approach. And really, it's the same idea. If you put the client at the center of the solution and you look at the problem from the client's perspective, that's likely when you're going to be able to solve the problem most effectively for them. One note maybe that was a high point and a point of optimism. We also learned in our work that remote and virtual approaches are feasible, and they can really be important for enhancing self-sufficiency, for capacity, and for resilience. So maybe we can move to the next slide. I think I'll just mention 4 different ways in which, practical ways in which we're trying to build these data-driven and client-centered supply chains. So one is we use an approach called human-centered design. And this is really a methodology that puts the creation of solutions for the user challenges back in the user's hands. And it's an approach where you bring together users and experts in that field. And when you're designing, you don't assume that just the specialists know the problem. You bring in the voices of those closest to the problem and build that into the design. So we did that with CStock, which is a mobile reporting and resupply tool that we've developed for community health volunteers. It's in use in Siaya and in 4 of the northern Asal counties in Wajir, Turkana, Samburu, and Mandera. And it was used successfully in Siaya, but we knew that if it was to try and reach nomadic and migratory communities in some of these far-flung places, we really needed to hear from them what would make them use it, what were their barriers, what were their needs, and we redesigned CStock for that purpose. And it's now being used by over 3,000 community health workers, some of whom have low literacy, some of whom have phone ownership and connectivity challenges, but yet they're able to use it to actually report on their stock status, and their supervisors, most importantly, are able to use that data to basically say, this is what we need, this is what the county needs to buy to meet these services. The other thing we do is we acknowledge that health workers need tools and support to actually make decisions effectively. With the advent of digitalization of data,
Yasmin did tell us that there was a power situation. We seem to have had, or she's been probably caught up where power's run out. And I would like to probably try to move to her next slide and help her complete her presentation. And I think her parting thoughts were really tap into the transformative power of digital, adapting innovations for context and clients. You can read, she's also focusing on building client-centric supply chains, developing new metrics for supply chains, and solutions.
I'm back, is that?
Great.
Sorry about that. Yes.
No problem.
So yes, I see we're on. Maybe one more word on the previous slide before we come to this one. Yep. So just to say that I think one of the things that was really important for seeing, one of the things we saw during the COVID period was disruption of services, because clients are scared to go to health facilities. And this is where the client-centeredness is really important. There's no point sending your commodities to a facility when there are no patients there. So it's really understanding, what does the new normal look like for patients? Are they going to come for reproductive health? We've seen a huge increase in pregnancy. How do we take the services and the products to where the patients are going to access them? And the last thing, maybe this virtual learning icon you see, one of the things we did pivoted rapidly on was recognizing that even health workers needed to protect themselves. Putting content online, and in helping subnational levels figure out how they could drive their own learning and competency-based journeys. So we can go to the next slide. Just maybe to think about as we move forward, a lot of people talk about, when are we going to go back to normal? And from our perspective, I think there's, first of all, as I mentioned, we believe the new normal when it comes to accessing services and products is likely to look different, because of the way, after 7 months and people's habits have changed around where and how they access health services, it's important for us to keep that in mind and make sure that we meet the clients where they're looking for products and services. One of the things we do have is to tap into the transformative power of digital and really adapting innovations for the context and the client. And that doesn't mean quickly bringing in solutions that haven't been tested and are not appropriate for our settings. But it does mean thinking strategically about how data can transform the way we serve clients better and how we build our supply chains. The one thing I would say is really thinking about new metrics, right, for measuring what success looks like. As we all saw, until now, many people have looked at efficiency as an important measure. But as we saw, efficiency was, with COVID, the supply chains were completely disrupted. So can we look at resilience? Can we look at other measures to measure successful supply chains in the context of pandemics and current and future, that lets us balance between efficiency and other measures of success, and really being creative about solutions that help supply chains withstand some of these shocks. We've heard some great solutions from all the panelists so far. Thank you.
Thank you so much for your input, Yasmin, and thank you all the panelists. We'll move quickly to questions and answer. And we received advanced questions. I want to thank the panelists for their insights. If you look at your screen, I'm going to actually take the liberty of replying to my question on email to save time. I would like to give 1 minute response to each panelist for the questions, and then I'll ask the panelists to give parting shots for a minute and then we will be able to close the session. We've got only 15 minutes remaining. So, Chindinma Ifipe, do you think technology is being used effectively to impact the cost of healthcare delivery? Is it being reduced? That's a question from Countable. Chindinma, how would you respond to that? Hello, are you able to hear us?
Hello, can you hear
Yes,
me?
that's nice. We can hear you loud and clear. Go ahead.
Great. Thank you so much for the question. So what I'd like to say is, so far we've done some work around utilizing technology to drive, effective healthcare systems on the continent, but there's still a lot of work to be done. For example, we need to really take advantage of telemedicines. I mean, we saw how critical it was for during this COVID-19 pandemic period. I mean, if we have telemedicine really as an efficient healthcare structure or system, we can deploy it to people in different settings, people that are dealing with different types of diseases. I mean, the use cases for technology in healthcare systems, I mean, they cannot be overemphasized. But what I'd really like to also just mention when I think about technology is that there is such a huge potential, such a huge untapped potential of leveraging the technology structures that we've seen really spurting around the continent in the past decade. So the opportunities are there. We need to leverage them. Good work is already being done. But
Thank you. Let me move to Dr. Ahmed Omar. I think this is messaging. What is your response to that for manufacturing supply chain? What should we be saying more of in the strategic communication? It's a question from Japaigo.
Thanks. In as far as communication is concerned, it cannot only be manufacturing and supply chain. It needs to be the complete package where you are creating enough education in the population so that there is a place where you can be able to consume whatever it is that you want to manufacture. When you've created that market and the market is there, then you come back to manufacturers. Manufacturers generally, and even supply chain firms, they want to make a profit, however little. And if we can be able to secure a market locally, as we are doing with the AMSP, the Africa Medical Supplies platform, as each government should be doing at the local level, then you will find that issues of manufacturing can be able to be easily communicated, accepted, and you find many more manufacturers adapting their factories or establishing completely new factories if they see that there is a good business opportunity there. This area cannot be done by government alone. And this, I think, needs to be clear to both government and the private sector. When we talk about all types of supplies, from kits to PPEs to masks to gloves, to ventilators, whatever it is that we need, will always mostly come from the private sector, but the government needs to provide that environment where manufacturers can be able to do good business. But in as far as communication is concerned, that well-established market, if government is very clear that we are going to buy if you manufacture within our borders, then I will be able to invest. But if there are signals from within the government purchasing procurement system that they prefer to procure from outside, then getting local manufacturing will be extremely difficult. So policy, assuring a market by good communication and education of the public, and then securing that market base for local manufacturers will be extremely useful. At Africa CDC, we are trying to use the Africa Free Trade area to expand that market to the 1.3 billion on the continent.
Thank you. Very clear, very clear. Harold, over to you. You saw the question, locally packaged products. Does it
Yeah.
work? In very
Yeah.
brief, 1 minute, your answer to that.
Yes, of course. I mean, yes, of course, it would work. From a public perspective, almost every country is urging the private sector to do production locally. So an aligned approach would be very appreciated, I would say. And for the private sector, it's important to do this in a gradual way. It can be started with release, then secondary packaging, primary packaging, formulation, and API production, because with every such step there needs to be associated training and exchange of information in order to ensure and retain the quality standards. Thank you.
Thank you. You know, Yasmin, I won't forget what Harold said. You measure what you treasure. And here is about, do we want to treasure outcomes in healthcare? Your quick thoughts on how can we improve measurements? There's the question.
Thank you. I think I'll just reiterate what I said earlier, which is that I think we really need to think strategically about how we measure the performance and success in a supply chain. You know, efficiency is really important, but not if there's no product reaching clients. So I think we need to balance measures of efficiency with resilience, with agility, and with responsiveness so that we can measure service to clients as well as efficiency. Thank you.
Thank you. And Stavros, I think the question is pretty broad, but from this consulting company, I think it's like, we know government needs to do a lot. They may need to do policy, environment, maybe commitment, but where can private sector help to improve manufacturing and supply chain on the continent? What are your real key send-home messages for us?
Look, I think stating the obvious in the response, I think private sector needs to work collaboratively with government, the state, and also the various institutions. You know, a carrot and stick approach might work in certain sectors, but is unlikely to be successful in our sector. And I say this because pharmaceutical products have a very different dimension to them, to other commodities. The quality and the safety aspects just alone that you have to go through are incredibly important considerations. So my response is that these plans have to be jointly developed, but then we've got to have the level of frankness, which I'm afraid doesn't often exist between the private and the public sector, that in the implementation process there's proper monitoring and evaluation, and that through appropriate structures and governance, this is followed every step of the way. And that's the point I was making, hopefully quite robustly earlier, is that we tend to talk a lot about these things, but when it comes down to implementation, we don't have the courage of our convictions. And this is where you need joint monitoring between the private and the public sector with proper governance systems, so that if people are missing deadlines or not implementing or not following a policy, that they need to be called out, but also there's got to be some type of sanction, and usually economic sanctions are the ones that work best. So that would be my take-home message, is a collaborative approach, proper governance structures, and proper monitoring and evaluation to ensure that execution and implementation happens. Now, everything's about execution, execution, execution. That's what we're lacking here. Thanks very much.
Thank you, Stavros. I think collaboration is the new innovation. And I want to just finally tell Mital Shah, thank you for your question. We actually are here as Africa Health Business to grow the business of health in Africa. I will reach out to you separately to show you what we can do to scale your growth, to partner with institutions, SMEs, local institutions, global institutions, because we do want to grow the health footprint in Africa. On the next slide, I'd like all the panelists to literally give us the 3 minutes, 3 words, 4 words, parting shot. I'll start with Chindinma Ifipe. Just your parting shots, few words, and then we'll wind up and close up. Chindinma?
Thank you again, Dr. Amit. So just as a parting remark, we need to make decisions, and we need to make really coordinated and sustainable decisions for the future of Africa tomorrow. Thank you.
Thank you so much. Ahmed, over to you. Your words.
Yeah, thanks, Amit. What I would say is there is no security in the supply chain if you do not manufacture what you need. So we must manufacture what we need. We can only then supplement with what someone else is manufacturing. If we don't do that, then we are not out of the woods yet.
Super, spot on. Harold?
Sorry, my light somehow went off. So you just mentioned collaboration is the new innovation. I would say collaboration in the sense of caring and sharing. This is what's needed in a transparent way.
Super, spot on. Stavros?
Thank you, Amit. 4 words: stop talking and start doing. Thank you.
Stop talking, start doing. Make it action. Yasmin?
Tap into the transformative power of digital, adapting for context and clients. Focus on clients. Thank you.
Focus on clients. Be client and patient-centered. Thank you, guys. Actually, we've done well with timing. I want to thank the attendees and the questions that have come in. I do want to then turn it over to Kaushal to show us the results of the poll and tell us what's happening next. So Kaushal Shah, over to you. Sorry, we can't hear you.
There we go.
Yes.
Yeah, thanks, Amit, and thank you to all the speakers for taking us through this session. It was very engaging and interesting. So now we come to quite an exciting part of our webinar where we take a look at the poll results from the pop-up questions that all the attendees have been answering. So the first question was, what are the biggest challenges to healthcare product manufacturing in Africa? And a staggering 38% answered that the lack of an enabling environment is a challenge, and 29% answered that lack of good infrastructure is also a massive challenge. This shows that going forward, we need the public sector to create a more enabling environment for the local production of healthcare products. We need to work on policies and regulations that will strengthen local manufacturing capabilities. But here, I think that the private sector and the public sector can work together collaboratively to bring these changes about together so that we can become a continent that becomes more self-reliant. So the second question was, what factors would boost local healthcare product manufacturing in Africa? And 32% answered that harmonization of the African regulatory environment and governance systems are important. Again, this shows that we need to work on policies and regulations that will strengthen manufacturing capabilities, I think not only on a national level, but also on a continental level. So this will make it easier for companies to set up multiple manufacturing sites to supply multiple countries with products that we really need, and also make it easier for organizations to navigate such a vast continent. An example of this is the African Medicines Regulatory Harmonization effort that has yielded quite noteworthy results at the stage of conducting joint assessment and inspections in East Africa. However, after production, it's still not possible for a company to file a single registration that is recognized by neighboring countries anywhere in sub-Saharan Africa today. The third question was, what are the biggest challenges to healthcare product supply chains in Africa? And 32% of you answered that fragmented markets, increasing the cost of distributing products is a challenge. So while we've spoken a lot on manufacturing today, we also need to think about our supply chains. The majority of the countries on the continent have very fragmented supply chains. And at each stage of the supply chain, markups are added to the products, resulting in high product prices. Also, a thing to think about is that fragmented supply chains also have the potential to compromise the quality of the products that we desperately need. So to get the value chain under control, governments can also work with the private sector to better enforce quality standards that would lead to better patient outcomes. Thank you, everyone. On behalf of Africa Healthcare Business, I want to extend a special thank you to our event partners who made this webinar possible. I would also like to highlight that next Thursday at 4 p.m. East Africa time, we'll be hosting a thematic session on the topic of managing the disease burden. If you're interested in learning more about Africa Health Business or our services and partnering with us, please feel free to reach out to me using the details on the screen. Thank you very much